Hello, everyone, and welcome to this month's Mock Talk. Practice does make proficiency. This is Mark Valenti and Brittany Wilson.
Hi, everyone.
So our Mock Talks are our approach to learning and development, which really seeks to think outside the box and present information in new and hopefully exciting ways. And we do these Mock Talks through the lens of motivational interviewing, which is helping people change. And of course, as always, it's focused on the third edition. Motivational interviewing is about helping people change behaviors and having them really focus on their change talk and promoting that through conversation. We will talk about the 4 steps of motivational interviewing, which are engaging, focusing, evoking, and planning. And motivational interviewing is based on the idea that change resides within each individual, and helpful guiders of change recognize that and help pull that change up to the surface, much like a well with water already inside. We will talk about the MI approach, which includes how well do we express empathy, promote partnership, soft and sustained talk, and as I mentioned, how do we cultivate that change talk. We will make references to Dan Pink's Drive, which talks about the 3 levels of motivation. And we will talk about the behavior change triangle, which says that 3 elements must be there before behavior change occurs. Someone must have the knowledge of what the change means. They must place an importance on it. And finally, they have the confidence to make that change. And it is up to a helpful guider of change to understand where are the barriers and how do we help promote each of the 3 levels. In these sessions, Brittany and I will be acting out different case studies, and we'll have a chance to really analyze and assess what we're talking about. Because this is a shortened amount of time, they will never be longer than 20 minutes. You will see sort of an accelerated conversation that may just be snippets of conversation as opposed to the full thing. And as always, these sessions are being recorded, so if you happen to just be listening in as opposed to viewing this, or if you want to send this to somebody else, you'll be able to access the recording through My Learning if you're part of the Highmark and Allegheny Health Network system, or on YouTube and our own channel, which is called Activation Station, where you can find this recording and any of our previous mock talks and the teasers in 20. When we look at communication, we're going to do timeouts, assess the communication through that motivational interviewing lens, rewind it, try some new things, and then time back in and assess and see what happened. So I'm going to turn this over to Brittany, who's going to talk about today's case study.
Thank you, Mark. So today's case study is called Breathe Easy, and it features, we're actually going to meet the patient. Her name is Regina. And Regina is a 67-year-old woman with COPD. She was diagnosed a little over a year ago, and she's had some occasional exacerbations. She's currently working on quitting smoking. She's got a 40-year smoking history, and since she started quitting, she started vaping instead. She explains that she went from a pack a day to only 4 cigarettes per day and is now feeling a lot better. She's also on a fixed income, and her doctor, Dr. Fix-It, would like her on Brio, which can be costly. She's coming into the office for a routine visit and meeting with her nurse care manager, Mike, for the first time in person. Now, Mike is currently learning about motivational interviewing, and he wants to apply some of the foundational principles he's learned to his conversation with Regina. So, how do we frame this? So we want to make sure that we identify any health-defying behaviors that could potentially, kind of derail her from her care plan. In this case, the vaping, and she's still smoking. We also want to affirm her for her health-seeking behavior. So any changes she's made, which there obviously are some that we'll explore in a bit. We also want to make sure that this aligns with our clinical goals. And those are most likely getting her to quit smoking, ensuring she's taking her medicine, ensuring she knows her symptoms, and then also that she knows the impact not following her care plan can have on those symptoms. So what are some things we can do to guide the patient and the conversation through a motivational interviewing lens? Let's brainstorm. So we want to ensure that we affirm her health-seeking behaviors by addressing what she's done so far. We want to try to ask some open-ended questions that are evoking so we can gauge the patient's perspective on any barriers that get in the way of her following her care plan. We want to get the patient's thoughts on next steps, and we want to assess the patient's current baseline knowledge and the disease impacts. Lastly, we want to ensure that we're promoting partnership by collaborating and offering support and resisting our writing reflex or our ideas about what Regina should do.
Yeah, and that's a great framework, Brittany. And I like the way that we're sort of brainstorming before we start talking and going into this. I know that whenever we're coaching people in the field, that's what we do. We actually sit down and start thinking about what do we really want to accomplish. So let's sort of tune into this case study with Mike meeting Regina for the first time in the office. And I'll be playing the part of Mike. Regina, it's a pleasure to finally meet you in person. I'm Mike, your nurse care manager.
Oh, Mike, it's so great to finally place a face to the name. Thank you for taking the time to come and see me.
My pleasure. It's what I do. So I see you're here for a routine visit. Tell me a bit about what you hope to get out of this visit.
Well, actually, I've kind of been dreading it.
Why is that?
It seems like every time I come in, I get haggled about my smoking, even though I cut down a lot and switched to vaping. They just don't think I care about my health at all.
You must care about your health, Regina. I mean, you're obviously made some changes. But vaping isn't any better. Have you seen any of the articles on it? I mean, it's killing young people.
I've heard that, yes, but I think people are jumping to conclusion. Smoking kills more people than vaping, just like the flu has killed more people than coronavirus. It's just a hot topic right now.
You believe that there's not enough evidence to support it?
Yeah, Mike, you get me. I mean, think about it. Vaping came out as a healthy alternative to smoking. It's literally vapor and it's heated with vegetable glycerin, which is made from veggies. I think big tobacco got worried and is behind all of those health claims. I read one article that said vaping is worse than smoking. Well, if so, why do I feel so much better?
Well, it's your choice whether or not to believe the research. Can I ask you a question?
Sure.
What are your thoughts on using the patch instead of vaping?
I'm not wearing the patch. I like the feeling of smoking. The vape does that for me.
A nebulizer will also do that for you, and that's where you're headed.
You're just siding with the doctor. I feel like everything gets blamed on smoking. You get COPD because of smoking. You get cancer because of smoking. You get kicked out of the long Walmart layaway line because of smoking.
Well, Regina, you obviously aren't ready to have a conversation about smoking today. It seems like you've made all the changes you're going to go with that. Can we talk about your medications?
I guess, but you're not going to be very happy with me.
Tell me more about what you mean.
Well, I'm supposed to be on Brio.
Supposed to be?
Well, it's really freaking expensive.
So you're telling me you aren't taking it?
No, that's not what I said. I'm taking it when I need to. I can't afford to take it every day, but I don't really need it every day.
Well, it's not a rescue inhaler. It's medicine that you have to take every day for it to work. So the way you're taking it kind of defeats the purpose.
So I've just been wasting my money the entire time? I just can't win.
Well, there are other options that are similar and cheaper. We can look into that today.
What do you mean? So they just put me on the most expensive one? It's like all the docs are friends with the farm reps. You just can't trust anyone making big bucks in healthcare.
I can't really speak to all that, but it seems like your barrier is cost. So what are your thoughts on seeing what the doctor can do that may be cheaper for you?
It would be helpful, but again, why wouldn't he just start me on the cheaper option?
What are your thoughts on asking him that?
No, thank you. I think I'll just make this appointment quick and skedaddle.
Well, you did say that you were dreading it. So we discussed a few things today. Let's chat after your appointment and see if he changes your medication. If not, I may be able to find some coupons for the Brio.
Okay, Mike. Thanks for talking with me. Good for nothing care manager.
Okay, well, you're welcome, and I'll see you in a little bit.
So let's do a timeout. Let's discuss the conversation here. So as we take a closer look at this, Mike, before the conversation, he framed the approach. He brainstormed and he came up with a few ideas. And he actually consistently used foundational principles of motivational interviewing like throughout the entire conversation. So reflecting back on that brainstorm, we're going to just take a little bit of a closer look to some of the great things he did. In one case, Regina's talking, it's the very beginning of the conversation, and she talks about, how she has cut down her smoking and switched to vaping. And he has a great reflective statement. He says, "You must care about your health, Regina. I mean, you've obviously made changes." He's affirming her for that. But then he goes on to say, but vaping isn't any better. Have you seen any of the articles on it? I mean, it's killing young people. So that's one instance in which Mike had an opportunity to kind of just affirm her and use that as an opportunity to cultivate her confidence. But he instead jumped to a conclusion and kind of pressed his values on. So in the end there, Mike kind of failed expressing empathy and promoting partnership. In another part of the conversation, Mike does a really effective job. He says, well, you have choices whether or not to believe in the research. Then he says, can I ask you a question? So he's asking permission. And Regina's like, sure, ask me a question. And he said, what are your thoughts on using the patch instead of vaping? So although asking permission is a wonderful way to promote partnership with motivational interviewing, the way he did it, he basically asked her and then gave her the writing reflex. He gave her a suggestion that was his. And we find out later that Regina's like, I'm not wearing that patch. I like the feeling of smoking, which that is all sustained talk there. The vape does that for me. So she's kind of aligning with her status quo and not wanting to change any behavior. So this is kind of where the conversation took a turn. So like many healthcare providers or like the current state, he kind of jumped straight to planning because we know what's good for our patients. We've already done the research. There's another point where Mike says, well, Regina, you obviously aren't ready to have a conversation about smoking today. Throughout the conversation, she had a lot of sustained talk, really no change talk. And then he goes on to say, it seems like you've made all the changes you're going to with that. This is actually an effective foundational element of motivational interviewing. Whenever somebody does not have change talk present, it's okay to say something like this. However, as we look at the conversation further, was there an opportunity for Mike to actually kind of grab onto some of the change talk she had in the beginning and take the conversation down a different pathway? And another thing he did really effectively is he asked her, he said, what are your thoughts on asking him that? But Regina had just said, why wouldn't he just start me on the cheaper option? So him asking her thoughts is a very nice way to evoke the patient's perspective. However, in this instance, he's kind of passing the buck. It almost doesn't make sense to fit it in here. It's like he didn't know when to use it. So I think we're going to take time to rewind. And although, again, he used all of the brainstorming, motivational interviewing lens exercises that he identified in the beginning, it really didn't, get executed as well as it should have.
That's right. So we're going to rewind back to the appointment in the beginning when Mike actually introduces himself to Regina, and he's going to try a couple different approaches. So let's get right back into that from the beginning. Regina, it's a pleasure to finally meet you in person. I'm Mike, your nurse care manager.
Oh, Mike, it's so great to finally place a face to the name. Thanks for taking the time to come and see me.
My pleasure. It's what I do. So I see you're here for a routine visit. Tell me a bit about what you hope to get out of this visit.
Well, actually, I've kind of been dreading it.
Why is that?
It seems that every time I come in, I get haggled about my smoking, even though I cut down a lot and switched to vaping. They just don't think I care about my health at all.
You must care about your health, Regina. I mean, you've made some big changes over the past few months.
I really have. I actually went from smoking a pack per day for like 40 years down to 4 cigarettes per day.
You have taken difficult steps to get to that goal. Tell me more about how you did that.
Well, it wasn't easy, that's for sure. I actually started vaping to supplement my cravings. I know it's a little controversial, but I can't tell you how much better my breathing is.
So these big changes have positively impacted your symptoms.
Absolutely.
You mentioned that vaping is a little controversial. Can you explain more about that?
Well, obviously, it's not as great as quitting smoking. I've seen news articles that made me a little nervous about going this route, like that people have died suddenly from it.
You have concerns about vaping.
Yeah, I mean, I know the best thing to do is to quit, but after 40 years, I really need to take baby steps to make this successful.
Well, Regina, it seems like you've given this a great deal of thought. You also have a lot of insight into the best way for you to go about this.
Yeah, I mean, my goal is to gradually drop the nicotine in the vape until I really don't need it anymore.
This is a temporary bridge to quitting.
Exactly.
So, Regina, it sounds like you have some other steps to take to get to your long-term goal. Can you tell me more about your thoughts on getting there?
Well, I don't want to just become addicted to vaping. I think I need to set timelines for dropping the nicotine level.
That sounds fair. What time frame do you have in mind?
I've already dropped the nicotine level once. At first, it's really difficult, but it takes me about a week to adjust. I feel like I could drop it gradually every week until I can go without nicotine.
It takes some work to adjust, but you get through it.
Yep,
And now you feel like you have a plan to move forward.
exactly.
Thank you for sharing your ideas. How can I support you during this process?
Mike, I wouldn't mind you calling me as you usually do. You're the first person to not tell me it's just as bad as smoking or shame me for vaping.
I'd be happy to check in with you weekly to see how things are going. I'm here to support you. Can we take some time to discuss some other aspects of your care plan?
Actually, yes. My doctor has me on Brio and I really can't afford it. I've just been taking it on days that my breathing is bothering me.
You're struggling with affording this medication.
Yeah, that's why I only take it as needed.
Yes, you mentioned that you're using it when it is needed. Can you tell me what you know about the medication Brio?
Well, I know it's for COPD and it's supposed to help me breathe. It's some new wonder drug, I guess.
You're absolutely correct. It is supposed to make breathing easier for those struggling with your condition. Do you mind if I share some things I know about it?
No, I don't mind.
Well, it's a great for long-term management and can prevent breathing difficulties. However, it is most effective when used daily. It's not meant to be a fast acting or meant to be used in acute situations.
Oh, you mean it really won't help me if I only take it when I need it?
That is correct. You seem surprised by this information. What are your thoughts on what I just shared?
Well, I definitely feel really silly. I mean, I've been taking a medication wrong and I didn't really understand it. But I can see why it hasn't made me feel any better.
There are many medications on the market, and all of them do different things. I've seen many patients and healthcare providers find themselves in similar situations.
Oh, well, it's good to know I'm not the only one.
So, you mentioned that the reason you were taking it sparingly was you could not afford it. What are your thoughts on exploring other options during your visit today?
I would like to get on something that I can afford and that will help me.
So, you're comfortable letting Dr. Fix It know that you want to explore options?
Oh, yes. Also, if I do change medications, can we go over it so I know how it works before I leave?
Absolutely. Let's meet briefly at checkout and review what happened with your appointment.
Sounds good to me. Thank you so much for your help today.
My pleasure. All right, let's take a closer look at the way this was sort of redone once we had a chance to rewind. And Mike really incorporated his motivational interviewing skill sets and strategy, and not just from a toolbox and asking questions sort of sometimes randomly, but really strategically promoting that partnership and cultivating change talk. And as we mentioned, of course, that change talk is already there. And that's the thing 99% of the time, the individual who's struggling with health seeking behaviors and is actually already verbalizing change talk. But in healthcare, we're sort of conditioned to focus on the deficit and not promote that change. So Regina definitely had a lot of change talk. And even when she starts talking about her vaping, oftentimes we kind of have that writing reflex where we talk about vaping being bad. But when Regina says that she cut down a lot of her cigarettes and switched to vaping, that in of itself is change talk because it shows that she's interested in making changes. At which case, Mike affirms her and says that she cares about her health. And instead of criticizing her, like in the first example, he affirms her that says that she's really made some big changes over the past few months. At which point, Regina seems excited and talks about the changes she's made, at which case, Mike again affirms her and validates the difficult steps. And he really is expressing empathy, understanding where she is at that moment, and promoting that partnership. And promoting partnership says that Mike is the healthcare professional and the expert in sort of all the clinical parts of his role, but Regina is truly the expert in her own experience and motivation. At which point, later on, this is called out because she says, Mike, you're the first person not to tell me it's just as bad as smoking. And she really values the fact that he affirms her. And when it goes back to the behavior change triangle, this helps increase her confidence. But what we don't know is how much she knows about the Brio at this point. And because of the foundation that Mike has built, she has an opportunity to talk more about the medication and what she knows. At which point she does seem to know a lot about it. He affirms her for that, but then asks if he can share additional information. And at that point, he's able to fill in the gaps of knowledge. And all of this really sets the stage for Regina to have that remarkable health experience because she feels more confident and it frees her to be her very best. So I want to thank you for joining us for the Mock Talk this month. This is Mark Valenti.
And Brittany Wilson.
Have an amazing day.